Hey, it's Mike, and I thought I'd do a quick update tonight on what is going on with the treatment for this trigeminal neuralgia, the use of Tegretol in treating the pain, and kind of give you an idea of what's happening. So, I've been on Tegretol now for 3 weeks. I'm still noticing some really strong side effects. I'm losing words constantly. Like, I can't think. I used to be very sharp and communicative, very easy for me to think of what I wanted to say and say it. Words were never an issue for me, but right now they really are, and I'm having a hard time struggling, staying focused and being able to communicate. I'm also struggling to focus both here at work and at home. So I can't stay on task, and even like watching television, simple things, I can't keep my focus long enough to watch a whole TV show at once. Movies are definitely out of the question. So I'll start watching something, and then within 5 minutes, my attention has gone somewhere else. And so I change the channel, change the show. It's really, really annoying. And I can't tell if it's a problem with the medication or if it's a clarity problem due to the condition. There's a couple things going on in my mind that could be an issue with this, and I'll get into that here in just a second. The Tegretol itself, the good thing is that it is keeping my pain down. So the pain level, I'm not feeling stabs at all right now. The first week that I was on it, I continually felt little bursts of pain. Those went away after the first week. And I think it's because the Tegretol has to have a little while to accumulate in your system and build up for it to reach its full effect. I'm only taking 400 milligrams right now, 200 in the morning, 200 at night, and it's extended release, so they kind of release all day long and all night long. The other thing that's been on my mind, and I'm not sure, I'm anxious to get to my neurologist next week because I've had some symptoms other than trigeminal neuralgia for several years now. So it's been in the back of my mind that possibly I've got MS, and I've had some symptoms for quite some time that kind of make me think that. For about 10 years ago, I started getting pain and numbness in my right quadricep, and I still have it's still numb. Even to this day, it's just stayed numb. I also went through a couple periods. 5 years ago, I got this tingling and numbness sensation when I was at work, and I ended up going to the hospital, and we did a full stroke workup on me. In the process, they did a CAT scan and MRI, and in the MRI, it did show like one little white area in my brain, but it was in a weird place. It was like in the middle of my brain, so they released me and they didn't diagnose it as MS. So they wanted me to come back within a year or two to get another MRI. Sorry for the shaky camera here. I'm still at work for tonight. But the symptoms went away, and so I didn't bother with it anymore. I didn't go back and get another MRI. They didn't really feel like that's what it was at the time, so I didn't either. And then a couple years ago, I had another round for a couple of months when my right arm and my right leg felt like they were falling asleep all day long. So they felt like that pins and needles sensation, and it would not go away. I was constantly trying to adjust my arm and move it around like I was needed to get the circulation back in it, but that wasn't the problem. There was something else. And I thought, I've got some back issues, so I thought that was probably it. It was just a pinched nerve, and it very well could be. That could be all it was. But because of the accumulation of these other symptoms over time, over the last few years, I'm anxious to get this MRI to see what it shows, because it's possible there's more to the story, and we'll see. So back to the Tegretol. Over time, what's my understanding that Tegretol can lose its effectiveness in treating this disorder. That you have to continue getting more and more higher dosages of it, which I don't want, because if the spacey feeling I've got right now is attributable to Tegretol, then I just don't want to keep getting more of that and making this worse. I would much rather try another drug, gabapentin or something else, to see if it would work. But I guess I'll go with the doctor's recommendation on this, and I'll tell him my concerns and how it's affecting my job, because it really is having an effect on my ability to do a good job right now. And people are being patient with me for the time being, but I don't know how long that's going to last. I mean, I work in a law firm. I analyze medical records. I do things that require attentiveness and precision and detail. And right now, I don't have any of that. By noon every day, so like last night, I had a great night's sleep. But then by noon today, I was falling asleep at my desk and just felt utterly exhausted. Like I couldn't even get up and walk around at all. So I don't know what is going on with that. And when I get home at night, like I'm about to leave my office right now, when I get home, I can't wait to go home and climb in bed. That's all I'm going to do, is just go home and just collapse. So, and that's every day, even on the weekends, so that kind of sucks. So I don't know where this exhaustion is coming from, but I got to get all this figured out. So next week is the neurologist appointment. I'm anxious to go. It's on February 1st, and I'll post a video after that to let everybody know what their thoughts are, and then when the MRI gets scheduled, we'll go from there and see what the next step is going to be. So anyway, those are my thoughts for today, and I appreciate you watching, and I hope you all take care and have a good pain-free day out there.